Now, long-term use of laxatives is not great. It doesn't really help with constipation in the long run, because the laxatives, usually what they do is they make they make the stool soft. And I want you to understand a really important thing, that the bowel is a muscle. So if you think of a muscle, and over time what happens is, if you're using your bowel normally, you'll have stools which your muscles are using to push through. So they have some resistance. So the muscles are being used when your bowel's functioning normally. So again, like I said, the bowel now is trying to move things along, but it doesn't have much resistance, because it's like a toothpaste tube, right? It's just all mush inside, and you're not really going to evacuate properly again when the stools are all mush. If the stools are well formed, then your bowels can transport that and it can move things through it. If the stools are all mush, which is usually the case when you're taking laxatives, then it's very difficult for your bowel to actually evacuate properly. So long-term use of laxatives is not really the solution. You need to train your bowel and get the muscles in your bowel to function properly and strengthen up to be able to evacuate properly. So we're going to try and encourage the bowel to function a little bit better by using some manual techniques and by using some cupping, which is going to stimulate the bowel muscle by stimulating and creating an artificial stress or stretch to the bowel muscles. The bowel muscles have got a lot of receptors in them, so when we get any form of stretch or stress to the tissues, it stimulates the bowel and it can help the bowel get moving. So we're going to start with some of that now. Okay.